To decrease the risk of infection and save personal protective equipment, hospital-based healthcare workers need to decrease the number of times they enter patient isolation rooms. Voice text and video calling can keep patients connected without the risk of direct contact. This video will orient you to some rapid deployment virtual healthcare communication tools. For the administrators and techies out there, we're going to demonstrate an any-device solution for secure internet communication using community-donated phones and tablets where patients and even healthcare workers have the option of using their own device or using a community device. The Signal Communication app does the heavy lifting. It provides secure 128-bit end-to-end encrypted communication. It's similar to WhatsApp, but is provided by a non-profit organization dedicated to free, private, secure communication. The Signal CEO and team have gotten behind this project and provided the means for inexpensive Wi-Fi tablets and older phones without SIM cards to join the network, which allows rapid deployment of any available device. For healthcare workers and patients, this is a way for the community to put a phone in your hand for secure talk, text, and video calling. Hopefully, these tools will improve the connection between patient and healthcare team, decrease the isolation of being in hospital with no visitors, and decrease the number of trips into isolation rooms, which will decrease PPE usage, decrease cross-contamination, and increase healthcare worker safety. This is a virtual care starter pack prepared by your community in response to the COVID-19 pandemic. In it, you will find 3 tablets or phone devices, 1 nursing station stand, and a quick start guide for patients and healthcare workers. The first thing you need to do with your package is connect your devices to your local Wi-Fi internet. Next, you need to consent the patient, and then either loan them a community device or have them install Signal onto their own device. Please carefully read and understand the system risks and benefits on your Quick Start card. Think of the community-donated device like you would a public computer in a library. Don't enter your personal information such as passwords or credit cards, and please don't modify it by downloading other apps or surfing the web. Only use the Signal app. The Signal Communications app provides secure, encrypted transmission over the internet, but the devices themselves are not fully secured. They often won't have passwords, and someone could steal the device. You can protect yourself by not texting any confidential information and by using the disappearing messages feature and setting it to 30 minutes. That way, whatever you do send is erased in a timely manner. You also need to understand the Signal number associated with each device. This is like a fake phone number that only works with the Signal app. You can't call non-Signal users, you can't make 911 calls, and other Signal users can call you if they know the Signal number of your device. Patients returning their devices to the healthcare team should double-check that any personal data is erased. If the patient has used the community device to call or receive calls from other Signal users, patients must contact these people to let them know to discontinue use of this Signal number. Nurses who are receiving a returned device from the patient also need to double-check that conversations are deleted, that disappearing messages is set to 30 minutes, and then need to disinfect the devices using usual hospital protocols. Don't worry if this sounds like a lot of steps. The Quick Start card has everything needed to get started, and for everything else, just go to the website, covidvirtualtools.ca. So, that's all you need to know to get started. These virtual tools can help patients and healthcare workers improve safety, decrease the feeling of isolation, and save personal protective equipment while we fight this COVID-19 pandemic. During the pandemic, our usual supply chain is broken, and the healthcare system itself can't deliver change quickly enough. So, it's up to the community to provide these tools in this time of need. Please share these resources and help hospitals around the world improve worker safety and decrease patient isolation. That's the end of the orientation video, but if you're ready for more, here are some pro tips from our pilot projects. If you have access to user-friendly vital signs equipment, you can do regular nursing check-ins using the video call feature and just observe the patient taking their own vital signs. To decrease the need for equipment and deal with large numbers of patients in isolation rooms, you can speed up deployment by getting patients to use their own device by downloading Signal and following the installation instructions. For healthcare workers who want to use their own personal device, they can request a private Signal number from the website and then follow some special installation instructions. In busy departments, headphones or a Bluetooth headset at the nursing station improve the quality of communication dramatically. In our pilot project, the tablet stand turned out to be quite important and provided a few surprises. When we tried permanent installations in patient rooms, the devices ended up being plugged in near a wall and patients couldn't access them. Our best success was usually with no stand for the patient, so that they kept the device close to their person. Nurses, on the other hand, did need a stand so that the device could be visible while charting at their nursing station. We found that one charging cord, long enough to reach the nursing station, was enough to rotate among their multiple devices. If you're lucky enough to get more than one 3-pack from the community, make sure you label them front and back with something unique. This is a Spider-Man pack that's shown here. For more healthcare worker pro tips and ideas, go to covidvirtualtools.ca. And please be sure to share your experience. Thank you very much, and be safe.